It's a big problem to deal with this type of problems. Patients taking finasteride or dutasteride, they feel they suffer because of the drug. And it's very difficult to tell the difference between what would have happened to them without taking the drug. They suffer from sexual problems, they have some depressive symptoms, and some of them even committed suicide because of claiming the drug to provoke that. It's not easy for the medical community to distinguish if this is because of the drug or it's because of the patient. We believe that these drugs are safe, but we need to be extremely careful on selecting the patients that should take them. If you find a patient that you don't think it's totally adequate for taking this type of drug, if you have the feeling that the patient is a little bit too obsessed or anxious about his condition, probably it's not the best candidate to take this drug. We call the nocebo phenomenon as phenomenon that appears when you read that something's going to happen to you if you take a drug. It's contrary to the placebo phenomenon. So if you read that this drug provokes in other patients this feeling, you might have the same feeling because of what you read, not because of the drug. But the patient feels it. So the real situation is that we don't have to discuss if the post-finasteride syndrome exists or not. We have to try to find what patient should not take that drug. Yes, I think it's very important to try to provide to these already selected patients that should not take oral finasteride other methods that they cannot spot on the web. So if they don't read what's going to happen to them, they have more chances of non-feeling it. And we have topical finasteride, and we have injected finasteride, mostly dutasteride, that would help these patients and they probably would not feel anything in their bodies. Well, in the future, I understand that most of the drugs we need locally, if we could stop taking them over the whole body, it will be a great advantage. So when treating alopecia areata, when treating androgenetic alopecia, even when treating acne, if we get enough quantity of the drug delivered through the skin, it will change totally the amount of secondary effects, even the amount of the quantity of drug you need to the whole body, because you just need to get to that specific area. So transdermal absorption of the drugs or new methods of delivery of the drugs, this mesotherapy method might be also really helpful in these cases.